Today I recall the very day when Ankit was quite worried about his upcoming pharma examination, and he asked me for help, and I said yes, I can help, but I need your help too after the examination is over. So he asked how I can help. So listening to the word how, so I have started with to tell the differences between heparin and warfarin, and actually that came in the examination, and he got a very good marks in the examination. So as we all know, this particular topic time and again asked in the second AB examination. Also the points from these differences come in the PG entrance examination. So first, heparin acts through intrinsic pathway. Intrinsic pathway. It acts very quickly, within minutes, but sadly it acts for hours. Regarding the drug interactions, it has few drug interactions. It has few drug interactions. And it is injectable, so it is given through the SC subcutaneous or IV route. The antidote is protamine sulfate. Protamine sulfate. And it actually have renal excretion. It have renal excretions. Whereas in contrary to heparin, warfarin have extrinsic pathway. It acts through extrinsic pathway. And it takes time, around hours, to show its action, but the action lasts for days. So it is लंबी रेस का घोड़ा. But the concern is here the drug interactions are far more, and that is the concern. So you have to be aware of the patient's health condition also. But it is given per oral. And Its antidote is vitamin K. And it is excreted through the liver. Now, few important points we should remember why we are a little concerned about using warfarin, particularly in pregnant women, due to the contrary syndrome. Contrary syndrome. What happens in contrary syndrome? There is a mnemonic for that. That is NCC. NCC stands for hypoplasia of nasal bridge, chondrodysplasia, and CNS malformation. CNS malformation. And how will you monitor its effectiveness? The best test for monitoring warfarin is INR, International Normalized Ratio. But there is another test we can do, that is prothrombin time. Whereas for heparin, we have to go for the AVD. If you mention all the points, this is good enough for you to get 10 out of 10. Or yes, because it's the difference, you will get 4 out of 4 or 5 out of 5. And then Mithun came. Mithun said, "This all are fine, but can you tell something about PG entrance examination? Anything special about PG entrance examination?" So pulled the one question from the Horizon 20th edition. White clot syndrome is seen in which of the condition? You can take your time. 1, 2, 3, 4, 5. The answer is heparin induced thrombocytopenia with thrombosis. I don't know whether you marked it right or not wrong, but this is the answer. Now, heparin induced thrombocytopenia and thrombosis is a very important topic that can come up as a question in upcoming Central Institute examination. Important thing, thrombocytopenia will be a concern only when the level dips below 20,000. Platelet count goes below 20,000. Then only the bleeding and other features are going to emerge. But the thrombocytosis result the thrombosis in both the limb and the pulmonary thrombosis. Limb so it is going to give rise to thrombosis in limb in the form of deep vein thrombosis, and also can lead to pulmonary thrombosis, which is a varying factor. It actually occurs due to the formation of IgG antibodies against the complex of heparin with platelet factor 4. Platelet factor 4. And drug of choice, first we have to stop heparin. And then we have to start direct thrombin inhibitors. Like lepirudin. And we should start warfarin only after platelet count return to baseline. Hope you like this presentation where we have tried to take a connection from a second MB topic which have been asked frequently to a new syndrome which is known as white clot syndrome. I don't know how many of you actually have heard this particular topic, white clot syndrome. and we have given the important points, because this question, if asked in your final MBA examination or even in your pathology examination, you can write these points, and that it would be good enough. And in case this question come in your upcoming examination, upcoming PG examination, you will be able to answer it. And we have given all the important data. When thrombocytopenia, when the platelet count drop below 20,000 count, then actually the symptoms appears. Then there is a thrombosis because formation of IgG antibodies against the complex of heparin and platelet 4. So these are the important factors that you should be aware of, and how to treat that condition. We have to give the direct thrombin inhibitor like lepidolin, and warfarin only going to be given after the platelet back to the baseline again. So these are the important point you should remember. And if you like this particular presentation, and try to connect between your pharma, patho and medicine. So if you like this presentation, let us know, if then we are going to be encouraged to update this sort of integrated topic. And really thankful to Ankit and Michun for their support, and AimExcellence really appreciate the people who actually supported AimExcellence, the whole concept behind AimExcellence and the integrated medicine. And if you like this presentation, continue to follow us in the Facebook, Twitter and YouTube. Thank you.